Hi everyone, welcome back to another episode of Nico the Vet. I thought today we might tackle the subject of cystitis in cats, but specifically some of it extrapolates to dogs, but predominantly this is a cat talk. So first of all, just to be a bit pedantic, what does the word cystitis mean? What do we mean by cystitis? And why is this important? Well, if we take, for example, conversations amongst human beings, so you talk to someone and they say, yes, I've got cystitis, what do we infer that to mean? And we infer that to mean a bacterial infection in the bladder. Now, technically, just saying cystitis doesn't mean I've got a bacterial infection, even though we infer that in people. And the reason that's important for this talk will become apparent as we go on. So if we just rewind a little bit and say, well, what does cystitis mean? Any medical word that ends in itis implies inflammation. So if you say I've got appendicitis, that means inflammation. The itis means inflammation, and the first part of the word appendix tells you where it is. So it's inflammation of the appendix. Or if you do arthritis, so again, itis means inflammation, arthro means joint. So if you say you've got arthritis, you've got inflammation in the joint. But really, that's all it tells you. It just tells you what is inflamed. It doesn't tell you why it's inflamed, and that can be important because the treatment types are different. So going back to cystitis, so itis means inflammation, and cysto comes from the Latin word for the bladder, so it means inflammation of the bladder. But really, it's almost meaningless to say I've got inflammation of my bladder, because in cats, we can't assume, like we do in people, that the majority of cases are due to bacterial infection. So what can cause cystitis in cats is a bunch of things. We'll start off with a familiar one, so a bacterial infection in the bladder, in which case you should call it bacterial cystitis. How often does that happen in cats under the age of about 12 years old? Not often at all. Probably 2% of cystitis cases we see in cats would be due to a bacterial infection. So not common at all. So it's not enough to just say it's probably an infection, have some antibiotics, and off you go. What are the other types of cystitis? You could get bladder stones, or if they're still microscopic, so you can't see them with the naked eye, you'd call them bladder crystals. So think of these stones as having sharp little edges, and they float around in the bladder, and these sharp little edges make them sort of big grains of sugar in your mind. You've got these sharp edges floating around in the bladder, and they cut and irritate the lining of the bladder, and that will cause cystitis, inflammation in the bladder. And in that case, we should quantify again. We say it's a urolith, which is the fancy name for a bladder stone, a urolith cystitis, or a crystal in the urine cystitis. How often do we see those in cats? Probably more commonly in this day and age, given that it's 2020, probably accounts for less than probably 5% of the cases we see. So the next category of cystitis could be growths in the bladder, either polyps, so not nasty, not cancer, or unfortunately, far more commonly, if you have a growth in your bladder, bladder cancers. They're extremely nasty, the bladder cancers. They spread quickly, and effectively, they kill you quickly too. What can we offer to treat these cases? Not a lot, not much makes any difference, so it's largely palliative care. Going back to the stones or the crystals in the bladder, what do you do about those? Depends on what the type of stone is. The most common stones are called struvite stones, which are made of magnesium, ammonium, and phosphate. And if you have those in your bladder, we can try to get rid of them by feeding you specialist diets made by the bigger food manufacturers. They will oftentimes be able to dissolve the stones. Not a quick process, probably 3 months for it to dissolve the stones, or we can go to surgery and remove the stones. And surgery is really the only option if you've made pretty large stones, too big for you to wee out, and which can't be dissolved by special diets, then you're down to surgery to have them removed. So bacterial cystitis, 2% of cases, maybe 3%, treat with antibiotics. Stone cystitis, depending on what it is, some stones we can dissolve with diet and we can manage with diet. Others need surgery. How often? Maybe 5% of cases. And then tumor cystitis, very rare again, maybe 1% of cases, not a lot we can do. So these are all small numbers. So what are the rest made up? So 85% of cases of cystitis in cats are going to be down to a condition called idiopathic cystitis. So going back to the nomenclature, so cystitis means inflammation of the bladder, and idiopathic Idiopathic is a wonderful medical word. It sounds well informed, it sounds intelligent, but really it means we don't know. So that means cystitis for reasons we don't know or we don't understand. In the human equivalent of this type of cystitis, it's called interstitial cystitis, and I've also in the veterinary literature it's sometimes called stress cystitis. So stress cystitis, idiopathic cystitis, or interstitial cystitis accounts for about 85%. How do we diagnose it? Well, no matter what's caused your cystitis, your symptoms are going to be much the same. So you've got your cat making frequent visits to the litter tray, trying to wee a lot, straining to wee. They might well be vocalizing their distress, so meowing or growling or yowling. It's pretty uncomfortable and passing very little to no wee, but they keep going again and again and again. And if you've ever had cystitis yourself, you'll appreciate what they're going through, because if you imagine the bladder is just a big bag of muscle, so you've got this big bag of muscle, and once it's inflamed and you've got cystitis, doesn't matter why, the reflex action of the bag of muscle is to contract. So you go from having a nice floppy bag collecting all the wee to this very small knotted bag of bladder, and really nothing can fit in there. So when your kidneys are sending more wee down to your bladder, as it gets to your bladder's angry and it's spasming, it can't really dilate to accept the wee, so even the tiniest amount of wee arriving in your bladder makes you feel like you've got to go. And that's why you and I and the cat, if we have cystitis, will have to keep going, and in reality when we go pass very little wee out. So the symptoms of cystitis are very much the same, but again, if we play the numbers, 85% of cats under the age of 12 are going to have this sort of interstitial slash stress slash idiopathic cystitis. So what does that mean? First of all, what is it? And if we go back to the word interstitial cystitis, what is the interstitium? Imagine, have a look at the room around you. Imagine the room around you is the bladder, and you are standing in the bladder, and then imagine how the room has been constructed. So let's say it's built out of bricks. So if the bricks that build the room around you are the equivalent of the cells that build your bladder, then holding the bricks together would be cement in our homes, and in your body, that cement that holds the cells together is called the interstitium. So bricks and the cement in your room are the equivalent of the cells and the interstitium that forms your bladder, this chamber of your bladder. And then the walls are generally plastered, and think of the plaster as also being interstitium in your body. So you've got your bladder made up of bricks, which are the cells, you've got the interstitium holding it together, and then lining the whole lot is the plaster work, which is also interstitial tissue. And the reason we call it interstitial cystitis is one of the fundamental causes or mechanisms in this process of interstitial cystitis is this interstitium, this plaster work and this cement holding the bricks together is just poor quality, meaning your body just doesn't make good interstitium. And that means when your bladder fills with wee, which remember wee is just think of it as an acid, which is a concentrating acid in your bladder. It can also be alkaline, because alkalines and acids can be equally irritating, but think of it as an acid. And so as you accumulate acid in your bladder, as it starts to leak through the cracks in the plaster and then leaks into the interstitium, the tissue holding your cells together, that's where all the nerve endings are. So you've got this leaky plaster, this leaky cement, and then you've got acid being constantly sort of pushed and oozing into it. And of course, that's really painful. It's not the only story. So you've got this not very good interstitium holding your bladder and lining your bladder, and then on top of that, what we think plays a big role are emotional states, particularly stress and anxiety. How did they figure this out? And I think it comes from the human model, where people who were suffering from recurrent bouts of cystitis were having lots of tests to look at all the possibilities we've discussed, and the tests were coming back saying, well, it's not an infection, so we don't need antibiotics. It's not a tumor, so we don't need to address that. And there's no stones and there's no crystals, so it's not causing that. So what's left? And for a long time, we didn't know. That's why we called it idiopathic. And then once we figured out the leaky interstitium, we sort of changed the name to that. But if that's the case, why is it not happening all the time? And the answer is again going back to the human model, we discovered that people who suffer with this interstitial cystitis, so it's not caused by anything else, we know that they have bouts, particularly when they're feeling anxious or stressed. And it came about from them seeing two doctors, for example. They see one for the bladder problem, one for the emotional state problem, the stress and the anxiety. And the stress and anxiety doctor is giving them stuff like Prozac to help them with the stress and anxiety. And suddenly their cystitis just sorts out, and they have far fewer episodes of it. And so the doctor sort of put two and two together and said, well, hang on, stress must be a trigger. So it must be one of the trigger factors that sets off the process. There's various clever models explaining why, but it's enough to know that just having a stressful or anxious time will trigger the process. And then if you then have leaky interstitium, then the acid sort of leaks between and starts burning the cells, and then you have a bout of cystitis. So in human beings, I think it's probably one of the least common forms of cystitis, but in cats, the far more common form. What to do? So the first thing to do is, well, if stress is the trigger, let's tackle the stress. Now, very often when I say that to people, they'll say, well, stress isn't a factor. My cat's not stressed. My cat's perfectly happy. And if they have other cats at home, they all get on well, and it's one big happy family. Well, often in case it's not. And that's because cat politics and cat psychology can be extremely subtle. They can be sort of just an undercurrent going on between one or more cats in the household, which is causing stress to one or both of them. A bit like you could meet a couple and they seem a very happy couple on the face of it, and it can be just daggers at dawn when they're not in public. So with cats, that could be a player. And again, you don't have to see one cat rocking in the corner, keening to itself in its terrible distress, and see the other one sort of prowling around as a very obvious antagonist. It can be much more subtle, particularly if you have just, for example, one feeding bowl, one water bowl, and one litter tray, and you keep them all in one room in the house, like the utility room or the kitchen. What you'll sometimes see is leading from the utility room or the kitchen is the living room. You'll see one cat lying on the sofa, just apparently chilling out and relaxing and sleeping and minding his own business. But that may not be what's happening. That cat might be sitting there staking his claim, saying that resource, that food bowl, that water bowl, and that litter tray is my property. And the other cat, if you want to use that, use it at your peril, because you may think I'm sitting here sleeping, but I'm actually keeping watch over what is mine, and I'm going to duff you up if you go and try and have that. So that can create a lot of stress for the other cat. So yes, household factors, so interpersonal relationships with the cats, that can do it, but also external factors. So the obvious is your neighbor buys a new cat. It's a great big scary cat prowling around your garden, and your cat sees it and thinks, oh my word, it's the end of days. People will sometimes say to me, well, it's not a factor because my cat doesn't go outside, so they should feel perfectly safe and protected in the house. Well, it's not as simple as that, because the cat looking out the window sees the other cat. The other cat has no respect for the fact that it's your back garden. If your cat's not defending that back garden, the new cat will say, it's mine. Your cat will then go, oh my word, we're under siege. And that is extremely stressful for them now, because they're constantly imagining that there's a threat from the outside. And just like people with agoraphobia, they amplify that risk, and then the mind starts telling you that there are monsters outside and they're all coming to get you, even though there aren't. But your mind is telling you that. So that is now your new reality. And of course, that's hugely stressful. And it doesn't have to be just the obvious, like a new cat. It could be your neighbor's got a new dog. There's building works going on outside. There's building works going on inside. And even subtle things within your own house, like just buying new furniture, that sort of change, that can unsettle the cat. And like I say, if you are an anxiety, a stressy sort of individual, just like you get in people, of course that's stressful. And that can trigger the stress reaction, which then triggers the nerve endings in the bladder, and then the leaky interstitium starts letting the acids leak through, particularly if there's competition for resource then, so you can't go pee because the other cat's protecting the litter tray, so you accumulate more acid and it burns your bladder even more, and bang, you've got cystitis. And so what we as cat owners will see is your cat's going to the litter tray again and again and again, trying to wee, very, very distressing, and we take them to the vet. Now, the reason it's taken us so long as vets to figure out that this idiopathic / interstitial/stress cystitis accounts for 85% of cases, is that for years we would have these cats presenting to us, and we would just extrapolate from the human model and go, yeah, you've probably got an infection, particularly girls rather than boys, just because of the anatomy of girls and boys. And we'd give them some antibiotics and probably some painkillers, anti-inflammatories, and within 2 to 3 days they'd get better, and we go, okay, clearly our medication fixed them. So for years we thought that's what's going on, and we're treating them completely appropriately. But we've figured out over time that these cats were not getting better because we gave them antibiotics or because we gave them anti-inflammatories. They were going to get better anyway. And that's because these cyclical stress episodes will come and go. And so they come along and the bladder becomes inflamed, and you've got your cystitis, your inflamed bladder, and then within 2 to 3 days, it all settles down and goes away naturally. So again, it didn't go away because we gave them the medications, particularly not the antibiotics. It went away because it was going to go away anyway. So now that we've figured that out, how do we manage these cases? Well, first of all, we want to be sure that it is interstitial cystitis. So we rule out it's not an infection, don't need antibiotics, it's not stones, don't need surgery or modified diets, and it's not tumor, so you don't need anything done there. So we're left with interstitial cystitis. There's your diagnosis. There's no infection, so no indication for antibiotics, but we need to give you pain relief because it bloody hurts. So pain relief, there's a bit of a debate about the best way to manage the pain. Some people are exponents of conventional painkillers, so either the opiates or the non-steroidal anti-inflammatories, and other schools of thought think more along the steroid line, which is not a painkiller, but it has an anti-inflammatory effect, and thereby that diminishes the pain. So that's in the acute case. That's the cat that's come to us today and is struggling to wee and can't wee. But what's more important? More important is to not have these episodes happening. So we don't want these stress triggers coming along. We want to de-stress this cat's life so they have fewer flare-ups. So stress management is probably one of the two critical pillars of the treatment for these guys. So how do we manage stress? There's various options. I really like the Feliway diffusers, which you may or may not have heard of. It works on pheromone action. Now, when these were first launched, I couldn't see that they would be that effective, but they've proven to be extraordinarily effective in probably the vast majority of cases. They give you a tangible benefit. The caveat is there's not going to be a quick fix. Would it were that easy to fix psychological problems, we'd all just take a tablet and all our issues would just go away. If you're trying to fix the psychological stress and anxiety that this cat's had long term, you're going to need to use something for a minimum, I would think, of 3, maybe 6 months, even longer or forever. So how does the Feliway work? It's a pheromone. Some people are familiar with the concepts of a pheromone. Often people say a pheromone is sort of a scent or a smell. To be pedantic, it's not a scent or a smell. It's a chemical marker, which obviously is picked up by our bodies. The brain then processes it and interprets it. So the chemical marker in the Feliway is basically a chemical marker that tells cats just to be calm and relax, and that the threat they imagine there isn't actually there. Think of it as the equivalent of if you have sort of several big gangs in inner cities like New York, for example, they'll often paint graffiti on the perimeter of their territory. Why do they do that? It's to warn others not to come in, but largely to reassure themselves too that, we're on our turf, we're on our territory, and therefore we're safe, and that helps to palliate some of their stress and anxiety because of the threats from neighboring gangs. Well, the Feliway pheromone works exactly the same. So the pheromone is picked up by the brain, it has a soothing, calming effect, and it's almost like a chemical, invisible form of graffitiing your whole house. So the cat will everything will be soothing in the house and reassuring, and that will help get rid of the stress in the vast majority of cases. But again, it's not a quick fix. You've really got to commit to it for the long term. If it doesn't work, or you want sort of a faster result, you can add other drugs which act directly on the brain in terms of what we call anxiolytics to try to get rid of anxiety. There's some interesting nutraceuticals on the market. One is called Zilkine, which is an interesting drug. Basically, it's derived from milk, so it's inverted commas a natural product or a nutraceutical. We're not entirely sure how it works. It seems to attach to the same receptors in the brain that Valium would attach to. So it has a sort of a calming effect without making you stoned. And so if you're calm and you go, okay, well, the thing that was freaking me out yesterday, I'm not so freaked out about, you've just alleviated your stress and your anxiety. And then in some cases may have to move on to tricyclic antidepressants, so things like amitriptyline or maybe even Prozac in the long term. So although I'm mentioning trade names particularly, I'm not endorsed or motivated by anyone in particular. I'm just mentioning what I find works for me. So that's treating the stress trigger. And obviously then create more resource. So if you've got multiple cats, you want to have one more litter tray than you have cats. So if you've got 3 cats, have 4 litter trays. You've got 5 cats, have 6 litter trays. And the same goes for food and water bowls, and have them in different rooms. That way, if you've got one sort of dictatorial, despotic personality, usually Burmese's, I've got one, so I can say that, they can't patrol and guard everything all the time, and that makes the resource more accessible to everybody else. So stress management, number 1. Second pillar, at least as important as the stress management, is go back to the idea that your bladder is full of this sort of acid solution that's leaking through the interstitium, burning the nerve endings. Well, if you can dilute that acid, if you can just add a lot more water to the acid is less stingy, less burny, because it's more diluted. So the way to do that is convert your cat to a wet food diet. So as you know, you get wet foods and dry foods. So switch exclusively to the wet foods, and you can even add water to that, so it's sort of a stew or a broth consistency, and that way the cat's taken in more water, therefore making more urine, and therefore diluting their normal amount of urine they would have made to a less sort of stingy, burny solution. You can also me and every other vet in the world have always said, get the cat to drink more, encourage them to drink more. Well, how do you encourage a cat to drink more? We've always suggested, buy these little water fountains. That's based on the idea that a lot of cats are interested in dripping taps and sort of running water out of the taps. I can't think I've ever had someone follow my advice, get the little fountain, and suddenly, presto, the cat's drinking more. So it's a nice idea. Give it a go. But I think adding water to the food is probably a more reliable way of being sure that the cat gets the increased water intake that we want. So if we're managing their stress long term and we're increasing their water intake and flushing them out long term, we should have far few episodes of the inflammatory process that happens, and the cat will lead a much happier, much more comfortable life. As a final note, an important note, is we also have to consider the anatomical difference between boys and girls. So, and this is true for human beings, cats and dogs, everybody. In all of us, we have a tube leading from the bladder to the outside world. That's called the urethra. In girls, that's a short, broad tube. And boys, that's a long, thin tube. So what does that mean? That means that if you're a girl and you've got cystitis, which is inflammation of the bladder, some of that inflammation can track down the tube. So if you imagine that's your urethra, that's the tube leading to the outside world. If you're a girl and you've got a big tube and it becomes swollen, it'll sort of swell down to sort of smaller, like that. But you've still got patency. That tube is still open, wee can still go out. So although it's uncomfortable and burning when you wee, you're fine. The difference in boys is they've got a long, narrow tube. So the tube is only that narrow to begin with. So when it becomes inflamed, it does that, and it swells shut even more. Now it's so swollen shut that you can't pass wee out of it. So effectively you are blocked. You can't get rid of urine. Why is that a big deal? Well, it's more than a big deal, it's a massive deal. Think of the kidneys, just to oversimplify it, think of the kidneys as filters that get rid of toxins for the body. So the kidneys are still getting rid of the toxins. They're still sending it to the bladder, which is just a repository waiting for you to wee, to get rid of those toxins. But now they're not being gotten rid of. So you've got these toxins accumulating in your system, and you'll start to become very, very sick. Added on to that, your potassium levels, because you're not weeing out potassium, your potassium levels will go high. And the impact of this is, think about people who've had heart surgery, heart valve replacement, or even heart replacement surgery. The way they stop your heart in that surgery is they give you an injection of a high dose of potassium. So if you're not peeing and you're accumulating potassium, as that potassium level goes up and up and up, that really starts to interfere with cardiac function, and you can get some crazy cardiac function coming in with these cats. So the girls, just don't get blocked. They've got the capacity to swell and accept it. Even if they make blood clots, they generally can pass the blood clots. And even if there is a bit of sand or microscopic grit that sticks in those clots and gives it sort of a horrible sort of sandy, crunchy texture, they can still weed out. The boys cannot very often. So either the swelling has just swollen it shut, or the blood clots associated with the inflammation in the bladder, the blood clots have gotten stuck, so you've got a spasm, then you've got a blood clot coming in, then you've got the spasm around your blood clot, and if there's grit in there, even more so, that's more scratchy, there's already scratching your already painful urethra, and the whole thing blocks. So you could have a true obstruction where you have something stuck in there, like say a blood clot or some grit or even a stone. If your problem was associated with bladder stones, they can vary in size from microscopic to virtually pea size. If they're big enough to move into the urethra but not out, then they're going to get stuck in the urethra. And typically the bit of urethra inside the actual willy that we see is bigger than the bit of the willy that we don't see inside of the body, connecting it to the bladder. So it'll often move halfway down the urethra and then get stuck in the willy. So you could have a true obstruction, so a stone, a clot, a grit, or you could just have a spasm and swelling constricting it, or you could have a combination of the both. The important point being, this doesn't happen to girls, does happen to boys. So if you see your cat straining in the litter tray, yowling and swearing and complaining and vocalizing their dissatisfaction, if you pressed and you can only take one to the vet today and the other's got to go tomorrow, take the boy. The boy is at much more risk. It's life-threatening. If we don't unblock these guys within 48 hours, apart from the extreme pain, there's this toxic and potassium chemical reaction which can very easily and will kill them if you don't sort it out. Whereas the girls, not to diminish it at all, of course they're in pain and they need addressing, but they are not going to be life-threatening. On that subject, because it's so wishy-washy and there's all these various causes of cystitis, in the medical world we've come up with the terminology FLUTD, which stands for feline lower urinary tract disease. The anagram for that is FLUTD, and when we say that, we sort of mean it to encompass all of the common cystitis as we see, and then also this problem in the males that we see that get blocked. So if cystitis happens as a one-off, sometimes it's just unlucky, something happened, there's no reason for why, then yes, your vet will probably just treat it appropriately according to what their tests have yielded. But if your cat keeps getting these bouts, keeps going to the vet, seems to be fixed within a day or two, it's not bacterial cystitis like we get, and although you'd swear, well, every time he has antibiotics it gets better, he was going to get better anyway, or she. And in those guys, we need to confirm that there are no tumors, stones or infection, and once we've done that, then we need to modify their lives, modify their stress management, modify their environment, and dilute their urine, and that will massively improve their quality of life. And cystitis is a big deal. Most men, they haven't ever really appreciated the discomfort of it, but I remember a nurse of mine once describing it as feeling like peeing bits of broken glass. Well, hell, if that doesn't make the point, nothing will. So awful feeling, very painful, very uncomfortable, very distressing, and if you are recurrently getting these episodes, it's massively going to negatively impact your life, and that will impact your relationship with the people around you and your environment. So I think it's an imperative. We have to identify these souls, and we have to treat them appropriately using the measures I've discussed. So hopefully that makes some sort of sense, and hopefully it motivates everyone to sort of maybe take a second look at what's going on with their cat, particularly if they have repeated episodes of this, and hopefully that means we have a lot more comfortable, happy cats. So thank you very much for joining me. As always, if you have any comments, please contact me on nicothevet@gmail.com, and if you have anything you particularly want me to talk about, I try and do these very informally, so they're just sort of off the cuff, sort of a conversation I would normally have with people in the consulting room. So although I can't discuss your particular case, I'm happy to discuss the concept and the ideology of the condition affecting your cat or dog. Sadly, I know nothing about reptiles, so there's many wiser people than me on that subject, and birds too, really. I'm not just up on birds. So cats and dog questions, absolutely bring them in and we'll address them. Thank you. Have a good one.